Okay, now muscle attachment can be asked to you on greater trochanter. Which muscle attaches to the greater trochanter of the femur? These are the medius, gluteus medius, gluteus minimus, piriformis, obturator internal, superior and inferior gemelli. On the lesser trochanter, muscle attachment is iliopsoas muscle, that is psoas major and iliacus. On the head of the femur, fovea which ligament is attached to the fovea capitis of the femoral head, ligament of head of the femur, or ligamentum teres. It is also known as ligamentum teres. Gluteus maximus attachment can be asked to you on the pelvic bone specimen, posterior on the posterior gluteal line of the ilium, dorsal surface of the sacrum, coccyx and sacrotuberal tuberous ligament. Where does the gluteus maximus inserted? On the iliotibial tract. You can see it in my video. Attached to the lateral condyle of the tibia, also known as Gerdy's tubercle. The gluteal tuberosity can be asked on the femur, on which the gluteus maximus is present. Gluteus medius origin is on the outer surface of the ilium between the anterior and posterior gluteal lines. Where does the gluteus medius inserted? On the lateral surface of the greater trochanter of the femur. Show the origin of the gluteus minimus on the hip bone model, outer surface of the ilium between the anterior and inferior gluteal lines. Where does the gluteal minimus insert? Anterior surface of greater trochanter of femur. Nerves and arteries can be asked to you, and the related question can be asked to you on that. Name the parent artery of the femoral artery. So it will be the external iliac artery. List the branches of the femoral artery in the thigh. Superficial epigastric artery, superficial circumflex iliac artery, superficial external pudendal artery, deep external pudendal artery, profundi femoris artery. Muscular branches, descending genicular artery. Name the branches of the profundi femoris artery. That is medial circumflex femoral artery, lateral circumflex femoral artery, perforating arteries. Popliteal artery is a continuation of which artery? List its terminal branches. It is a continuation of femoral artery, and terminal branches are anterior tibial and posterior tibial. What are the branches of dorsalis pedis artery? Medial tarsal arteries, lateral tarsal artery, arcuate artery, first dorsal metatarsal artery, deep plantar artery. I have told you the mnemonic for that in my Viva related video. Name the terminal branches of the posterior tibial artery, medial plantar artery, lateral plantar artery. Which vein is known as the longest vein in the body, and where does it drain? It is a great saphenous vein. It drains into the femoral vein at the saphenofemoral junction. Which vein drains at the lateral side of the foot and the leg, and into which vein does it end? Small saphenous vein, which drains into the popliteal vein. Name the parent nerve of the tibial nerve. So it is the sciatic nerve. Name the branches of the tibial nerve. So these are the branches of the tibial nerve are muscular branches to the calf muscles, medial soleal cutaneous nerve, articular branch to the ankle. Terminal branches are medial and lateral plantar nerve. The common peroneal nerve arises from which parent nerve? It's the sciatic nerve, and terminal branches are deep peroneal or superficial peroneal nerve, or it is also known as deep peroneal or superficial deep fibular or superficial fibular nerve. List the terminal branches of the femoral nerve. Muscular branches to the anterior thigh muscles, cutaneous branches, anterior femoral, cutaneous and saphenous nerve. Terminal branches. Name the branches of the obturator nerve, anterior division and posterior division. Name the branches of the sciatic nerve, tibial and common peroneal nerve, or also known as fibular nerve. This picture can be given to you, in which here it is this is written over here. It is by mistakenly. In this picture there's a material written over here, but you can see the picture. You can see the muscles on the picture. This is the medial on the thumb. There will be the medial head on the thumb side. There will be the medial end of the medial gastrocnemius, medial head of the gastrocnemius muscle. It is the lateral head of the gastrocnemius muscle towards the little finger, and they are going to be inserted on the Achilles tendon, and which is going to be inserted on the calcaneum or tendocalcaneum or calcaneus tendon. These three are the names for that, and the question can be asked to you on the gastrocnemius muscle. Both heads are supplied by the sural arteries, and additional supply is by the muscular branches of the posterior tibial artery. Peroneal artery contributions. Soleus muscle as arterial supply can be asked to you, that is posterior tibial artery. Gastrocnemius muscle, both medial and lateral heads are supplied by the tibial nerve, and as root values are S1 and S2, and soleus nerve supplies by the tibial nerve. Root values are S1 and S2, and mainly by S1. Muscle attachments for the osteology point of view is very important. Muscle attachment on tibia and fibula can be asked to you. Medial condyle on the medial condyle of the tibia. Name the muscle attached on the medial condyle of the tibia or mark the structure. It can be asked to you. Obviously, it is not asked to you like this. I'm going to make a separate video on that.